Hi, I'm Dr. Kelly, an occupational therapist, and I'm here to discuss proprioception. What is proprioception? That's the input we receive from our environment or an outside stimuli. It's required for our muscles, our joints, our tendons to connect to our brain for proper body positioning, movement, coordination. Now, some of our kiddos may lack this. And how does it display? When we notice that our kiddos require those deep hugs or they like to crash into things, that is their way of getting that input that they're not naturally receiving from their environment. So how can we help? How can OT help? OT works with the kiddos and the families to implement strategies. So some of the strategies I'm going to go over briefly. So what we call our deep pressure strategies. You may have heard that term before. So some deep pressure strategies. The first one, again, is obvious. Teach your child to self-hug, right? Cross over our bodies and squeeze at the shoulders. Another one that is very useful is a massage. Hands on opposite shoulders, fingers facing down toward the ground. Again, do a nice squeeze up. I like to count for 5, 4, 3, 2, 1, and release. And you do that multiple times. Again, always checking in to see how your kiddo is reacting and to see if you need to provide a variation. Another one that you might have heard of is called the taco roll. So what you want to do is take a blanket, a comforter, roll your kiddo up with the head facing out, and we're gonna roll the kiddo in the blanket back and forth a couple times. Again, checking in, repeat if needed. The focus is providing that pressure, that input, so their body can then regulate itself to improve their movements, coordination, and then their body awareness, most importantly. Another strategy is animal walks. That again provides input from the hands and the feet, such as bear walks, crab walks. Yoga poses are good for this, like a downward dog, a child pose. Again, check in with your kiddo, see if things need to be shifted a little, do it again. And always check in and provide trials as needed. Another good one is what I'm sure you've heard is called heavy work. So what do we mean by heavy work? Well, that is something like a push-pull effect. So one of the things I like to recommend is a laundry basket because most households have one. You fill it up with the kiddos' toys, or you can actually have them have their dirty clothes in it and you have them push and pull, push and pull. Again, that can be across one room to the other, repeat as needed, but that's also a good one. I also recommend doing that right before bed. It helps to get the input they need to kind of regulate, prepare their body, and it helps to calm them because they're not seeking that pressure, they're receiving it. To see how further occupational therapy can help, or for a consultation, reach out to us at www.backtometherapy.com.